If we're not careful, this is Henry talking to you all. The cost of healthcare is going to get so high where people are going to have to make decisions. Do I eat today? Do I pay my rent today? Do I go to the doctor today?
Since the passage of the Unaffordable Care Act, sometimes
I really don't understand why they say this Unaffordable Care Act. It was super affordable. But I am glad he didn't call it Obamacare because I don't understand that.
Sometimes referred to as Obamacare, big insurance company.
I'm sorry. Forgive me.
Insurance company has gotten rich. It was meant for the insurance companies, not for the people.
It's insane. One of the biggest things is pre-existing conditions. And one of the things that I've been pressing on people, if you're not careful, they will do away with pre-existing conditions. What that means is if you have a diagnosis of, let's say, cancer, and then you need insurance for whatever reason you didn't have it, when you go to get it, the cost would have been so high you would not have been able to afford it, or you could have been denied. So now this makes the insurance companies give you insurance, even if it's at a higher rate, but now you can go through and get treatments and stay alive. So you can get chemo, radiation, things like that. So while they may have made money other places, as someone who's in hospice, I can tell you, they definitely ended up paying for more treatments on the back end. So therefore, it's difficult for me to agree with what he's saying on that part.
With our government giving them hundreds and hundreds of billions of dollars a year, as their stock prices soared 1,000.
Again, this is just, there's no context here. And it's not that because of the way our government is set up, they do have a lock on the entire industry. All big insurance companies do. But again, this is something that you all let happen. So you don't have a situation where we can independently pick our own insurances because the barrier to entry to starting an insurance company is through the roof, right? If everyone could open one or people could get together and open one, then you maybe would have better outcomes. But because you can't do that, I don't really know if that's really the right type of argument that I would have been making.
Soared 1,000, 1,200, 1,400, and even 1,700%, like nothing else. That's why
market also went up significantly altogether, right? Not 1,700%, but just you gotta have some context with some of these things.
That's why I introduced the great healthcare plan. I want to stop all payments to big insurance companies and instead give that money directly to the people so they can buy their own healthcare, which will be better healthcare at a much lower cost.
That's probably not possible. I do agree that that would be fantastic if we can get healthcare as cheap as possible. But the Affordable Care Act, a lot of that plan, those were subsidized plans. So if you take away those subsidies, which is essentially what he wants to do, you still have to make that up. So what I tell you that I'm seeing right now